Awesome. Okay. So we created this chat to allow people to ask questions, kind of bounce ideas off of each other, for me to review things more specifically, advance treatments and protocols. What is great is that this week I will be heading to Clarion, and we're going to work with a little bit more advancements, which will be awesome with the IPL device. So has everyone received like the Lucent protocol that has good parameters and understanding of what filter to use and what treatment? So I do want to start going off on a question that someone has. Does anyone have a question or anything they want to discuss in more detail? Do you feel like you're utilizing your device to the fullest?
No, not yet.
Not yet. So I know, so what did you find anything that you wanted to talk more specifically about with the IPL?
No, I think it's just going to take a lot of practice and, you know, and just having these little chats with you with pointers, I think is going to be very, very helpful.
Yeah, okay, absolutely. So what I can do is just dive into some additional things. Does anyone treat bruising? Has anyone treated bruising with this system yet?
Not yet, but I plan on it.
Okay. Okay. So, so the 560 is really good for those light colored bruises. When you have the light color bruising, then normally you want to bring down your milliseconds and your heat. Okay. So you want low milliseconds and low heat to affect that bruise. So when you're treating with the 560, usually you sit around that 6 milliseconds, single pulse, 6 milliseconds, and with around that 12 joules of energy. That is the same with your 585 filter. Okay, so your 585 is going to target more of the darker bruising, deeper, darker bruising. Now, sometimes you can have a tissue reaction, sometimes you don't. Bruising can be a little difficult that way. So you want to base it off of the patient. You do like 2 to 3 passes, and sometimes you can see darkening of that area before it goes away, or you can see the bruise lighten up. So either or can happen. All right. You just don't want it to make it look really bad, because that means that the energy was just too much. So that's what happens with bruising. So the 585, deep, darker bruising. The 560 is going to be really good for that superficial bruise. Okay. Any questions on that?
Would you repeat the fluence that you said and the milliseconds?
Yeah. So single pulse starting at 6 milliseconds and starting at 12 joules. And that is a good start for both the 560 and the 585 nanometer filters. If you have stubborn superficial pigment, okay, we've all been there where we've done, where we targeted those pigmented lesions and you have that feisty one that's just sitting there, 430 is a really great filter to use, especially on the hands. So on the hands, you can do a 515 and then you can do that 430 on top of there, and it's going to get that superficial lentiginous, and it's going to come up to that surface. So that's a really good combo as well, even on the chest, the face. So that 430 can absolutely be utilized as that. If you're doing an acne treatment, 430 is really good. You want to do it every 2 weeks. Okay, usually a series of 4 to 6, depending on the severity. If it's cystic acne associated with that, of course, it's going to be a multi, you know, you want a whole umbrella you know, you want to look at medications, topicals, stuff like that. But if you have cystic acne, then you're going to utilize your 640 for that. Okay, it's going to go deeper. It's going to help better target those sebaceous glands. Okay. Has everyone had great success with pigmented lesions or have questions about what to use, how to use anything? I'm here for you, so please let me know if you'd like me to review or go in more depth. Everyone's had perfect results?
We just got our machine, so
Okay.
we haven't even started. So someone came out to do training, and then I got the email that like protocols and stuff have changed. So haven't even used it yet. Brand new practice.
Oh, okay. Okay. So did you receive the it should be like the 1.1 version? Did you receive that?
I think that's, I'd have to go through my email and I'm driving, but I think that was, I think that's what we were just recently sent. Right. And it
Okay.
was almost like 2 or 3 days after training. When
Okay.
the trainer came out, and then we went over those protocols and those numbers. And then my medical director sent an email like they're having classes because they updated the protocol and the numbers. And it was like within 3 days. It's like, oh, okay. So I think that was in the email though. I think
Okay.
the updated protocols were in the email.
Okay. Well, if it's not, you can always reach out to me. So, so what happened is we brought this together because a lot of people had questions, wanted to know a little bit more detailed information on how to use the IPL. So that's why we created this. And if people are interested in, we can do other devices as well. So, okay. So we have a question that love to review toning again. And basically the mode, so single, double, and triple, and when to use each. Absolutely. So that can be confusing for some people. So you have your single pulse. Your single pulse is all the energy being delivered, like almost like a slap, right? So that is your most aggressive. That is usually my go-to. Especially for pigment. That is my absolute go-to for pigment because you want to get those pigment lesions. You want to treat them. You want that stuff to bring brought up to the surface. So that's going to be your most aggressive. When you get into a double pulse, you want, basically what it's doing is say you have your energy at 20 joules, okay? What is happening is you have your milliseconds, your delay. So the milliseconds it's splitting that energy and you're creating that time in between that energy that's going to be delivered. It's still going to be 20 joules, but it's breaking it in half. Say, for instance, if it's 7 milliseconds, it's going to be a lot quicker. And say you have a 20 millisecond delay. It's too fast for the eye to see. But you are, when you do a treatment, you're going to see that pulse kind of take a little bit longer to linger. And that's because it's separating that energy. One, it produces a longer duration technically on the face for vascular lesions. So if you have someone that has like moderate to severe telangiectasias, rosacea, this is going to add more comfort because you're not just delivering that energy very aggressively. You're spreading it out over time. So double pulse is really good if you have a lower pain threshold, should I say. And if you're wanting to have a little bit more control of when that energy is delivered, but it's going to be a longer period of time, okay? When you have a triple pulse, I will say we're figuring out some advanced settings for a triple pulse to kind of utilize that a little bit more. And I will be going this week, so it's super exciting to figure this out. But the triple pulse, what it does is it basically splits that energy into 3. So sometimes your energy has to be higher to meet that demand of splitting that energy. Rarely do I do triple pulse. That is, you can use that for people that had severe redness, because whenever you have any type of vascularity or rosacea patients, it's going to be a lot more sensitive because those blood vessels are more superficial. It's also deep, and you're having to add heat to calm it down. So triple pulse can be used for that. So you're just spreading that energy more. Now, all of these are in one pulse, but you'll notice from a single pulse to a double to a triple, you're going to notice that the light is going to be a little bit longer delivered onto the skin in that one pulse. Okay. When you're doing double and triple, it just takes a little bit longer also as the provider to do a treatment because you have to let that energy sit for a little bit. When you're using toning pulse, patients can actually feel this. I don't know if any of you received a treatment on yourself, but it's like a single pulse being put onto the skin, but it's in subpulses, and you can kind of feel those transitions as a subpulse. Since it's creating the subpulses, one, it's able to treat technically each layer, but it has a longer tissue delay, so you have to give it some time. Toning pulse is really popular on Clarion's treatment protocol to heat up the skin on someone that has a lot of skin indications happening, or someone that is a darker skin tone, or just starting to use the device and trying to figure out, okay, how is this patient going to react? And it's also a little bit safer because you're heating up that tissue, then you're coming in more aggressively and targeting those indications that are coming up or need to be targeted. Toning pulse on the new protocol. It can be a little confusing because there's toning prep and there's toning treatment. Toning prep is based on Clarion settings, what they like to use for their parameters to do a pre-treatment. A toning treatment is going to be more aggressive. You want your patient, since it has a delay reaction, when you do this, you want the patient to feel some heat. You want them to feel like they have a mild sunburn. If you're not there with that toning pulse, then you need to increase your energy. Always increase your energy, then manipulate your milliseconds. Okay. So I hope that answers, did that clarify some things for you on what those mean? Did that help?
Yes, that was
Okay, thank you. So my goal though for this week is how can you utilize the second and third pulse to your best advantage? So I will definitely be having another one of these when I come back from Clarion, and because we're all working together and we're coming up with awesome advanced treatment protocols even more, right? What company does this? What company enhances their product to the best that it can? So, which is really cool. So this is one of my favorites. So when you're working with these pulses, I will say if anyone's doing this with permanent hair reduction, usually a double and a triple pulse, ironically, is the best to start on. I will say with my experience, triple pulse treating someone for vascular or pigmented lesions, I rarely touch it. I am at a single, a double, or a toning. I definitely naturally heat up the skin and prep the skin with my toning if a patient has a lot going on or if they're a darker skin type, because that's going to be the safest, and you always use your deepest nanometer first and then work more superficially. You will get the best outcome and it will be the most safe for your patients. So we have some questions. So treatment for redness, rosacea, how many passes starting with toning pulse? You can absolutely start with toning pulse with rosacea. My recommendation is going straight to a double pulse. So when you're treating, there's a difference. So if you're treating that facial flushing, the deeper vessels, you want to start with your 585. Then you can come back with your superficial telangiectasias that sometimes can be left over. And you can do a treatment with that in a double pulse. And if that doesn't work, automatically change it to a single pulse. So if you're not getting that clinical endpoint you want to see with the superficial vessels, automatically switch from a double to a single pulse. Okay. Otherwise, you're going to be messing around with your heat a lot. I recommend just switching it straight to a more snappier effect. With rosacea, you can do up 2 to 3 passes. I say don't go past 3 passes and don't go more than 3 filters when you're treating a patient. With redness, it's that clinical indication that you want to look for. You can also utilize your 515 if your 560 is still not targeting. Okay, sometimes people say, I'm still not targeting it. I don't know what's happening. I turned up my energy. Change your filter. Okay, a lot of people forget then it needs to go more superficial because that deeper filter, it produces that energy at that filter and misses everything above. So what is happening is if that is more superficial, if the 560 doesn't work around the nose, do a 515. If you're doing hemangiomas and I will say this, 515 and 430 is the best for that. We'll get into that. But when you're treating that, if you're noticing you're changing your energy, then go more superficial with your filter. So for redness, they're going to be overall red. And I don't know if anyone had it, but a lot of rosacea patients, what can happen is they'll get red and then you'll see it blanch and almost like come in a bunch. That's a really good clinical endpoint. You can also have purpura. There's a difference though. There's purpura that happens immediately, which means your energy is way too high, or there's purpura that slowly comes over time, but is visible by the end of the treatment. Okay, so if it's gradual, then it's absolutely fine. That can happen, and it will last a couple of days. If that purpura were to occur, you don't want to treat it with the bruising setting. You actually want to give it its time. And the biggest thing is the aftercare for treating anyone that has vascularity. Your aftercare is super important. So when you do a treatment on someone, you don't want them to go exercise, have a cocktail, coffee, spicy foods, anything that creates those blood vessels to open up. Usually within those 48 to 72 hours, it's going to look like they didn't have anything done. So you really want to be aware of the aftercare for your patients. And let me know if I didn't answer the questions appropriately. Sometimes I'll just keep going. For hair removal, recommendation as to which pulse to use. So for permanent hair reduction, actually, before we get into that, I see we have a couple of people. So do we want Dr. McCall?
Yes. Can you just, can you go over exactly what you tell your patients afterwards? Like you were just saying, no alcohol, no exercise, not getting overheated after you treat the rosacea people with the telangiectasias?
Yes, absolutely. So I tell my patients that anything that makes them pink, red, feel hot, don't do. So that includes hot showers, hot baths. So when we're doing an IPL, it's non-invasive. We're not opening up the skin. So you can apply product right afterwards. But no saunas, especially since it's so cold for a lot of people. No hot tubs. You want to avoid spicy foods, alcohol, increase cardio, anything, even like no yoga. They can do light weights, but I'm trying to think of what else. Cooking. So you even want cooking, right? You'd be surprised. And even like going out and walking your dog for long periods of time, right? Anything that increases that blood flow. or anything irritant, right? So if they use, even sometimes if you use a retinol, that's going to increase, especially for red rosacea patients, that's going to increase that blood flow, right? You're creating that circulation to create the collagenesis, thicken up the skin, etc. So I recommend them not to do that at least 48 to 72 hours. And I tell them, if you can hold off that 72 hours, you're going to get a better outcome from this treatment. If for any reason you can't, just expect that we're going to have to do a few more treatments. You know, of course, it's going to take more than one treatment until you get that clinical end result, their expectations. But you really want to think, because if you did a treatment, let's say you did a treatment on someone, they went and saw their friend and they did yoga and then they had a cocktail afterwards, your treatment didn't do anything. Those blood vessels are back open. There's probably more now. They're a lot more red and they're not going to see a big difference.
Okay. Thank you. Do y'all have all that in a handout that you recommend, or that's just stuff you usually tell people?
That's stuff I usually tell people. I can see if I have something written down and I can send that to you. Let me look. I don't want to promise anything, but I can see what I have. Like, let me look first.
No problem.
But yeah,
Thank you.
I'll take note of that. And then we had another question. Is it Dr. Greenhaw?
Yeah, I think my phone's logged in under my daughter's name, and I don't know how to fix it. So,
Okay.
yes. So I was curious about the purpura that develops over time during the treatment. Do you have them use arnica or anything, or what do you recommend for that for post care?
Yeah, great question. So arnica if they have it, or just ice. Right after I do a treatment with a patient, I definitely ice the skin. Another trick is I use vinegar soaks. I don't know if anyone has heard of that, but if someone has, so there's different options. So, and this is in general, especially with the purpura. So if someone has a really good heat response and histamine, I'm sure we've all seen that. You can apply straight white distilled vinegar on their skin. Now, some people can have a sensitivity to it. It's not very often, but if they do, they'll say that it's hotter. The heat did not come down. If someone does not have a sensitivity, what will happen is they'll automatically feel a sense of relief. So it's an old trick. They did that back in the day for sunburns. You apply straight vinegar and it will draw that heat out and you can feel that heat. Then ice, cool the skin down. And sometimes I'll even use cortisone cream on someone to calm that inflammation down. And it works wonderful. Just over the counter cortisone cream helps. Now for arnica, I really like to use the gel. I've noticed that the gel, it just soaks into the skin a lot better than the cream. So the gel is really nice. I even use that for injections. That's my favorite to use. And I mean, you can get it off of Amazon. You can get it. I forgot what the main brand is called. Let me look. Yes, you can use aloe vera as well. I use aloe vera for the body. One thing about aloe vera is you want to make sure it's alcohol free. A lot of the product is not, it has alcohol in it, and that's where you get that severe dryness. And sometimes you get a burning effect right after where it just gets really hot again, and that's because of the alcohol in it. It is... Okay, so the arnica that I like to get, I'm sure you guys have heard of it, is the Boiron. Have you guys seen that one? It's in a lot of stores, but it's usually for like muscle and cramps, bruises, injury. I love using that stuff. On the body, it's a large area, you can use that. You can use that as well. Absolutely. So I will put that in the message. of the product that I use for the arnica. So I'll type that in here. Let's see. But that bruising, what can happen with those rosacea patients is that bruising can last 3, even up to 5 days. And it's almost like a little tiny purple bruise, and that is absolutely normal. So you just want to ensure that bruising can happen. And that can happen too when you're treating underneath the eyes. Now, some vessels that are on the cheeks, quite a bit of them comes from underneath the eye. So if you're able to treat underneath the eye first, I highly recommend that. And you'll see sometimes majority of those vessels can just go away. So a lot of that is diffused from underneath the eyes. That can also have some swelling. So just making sure, and if they really need to, if they have an inflammatory reaction, have some histamine. I've had patients had swelling actually for 5 days. They just had a really good response. They use his photos for before and afters. Then I had him use, you can do Zyrtec. You can do, you can use Benadryl. Some people don't like to, but the biggest thing is Zyrtec, and it will calm that inflammatory response down. Okay, so I just typed in that arnica gel. Any questions about bruising since we're on that topic? Okay. So for permanent hair reduction, using this device for that, which pulse to use, and then the 3, yes, okay. So for the permanent hair reduction, if you're going to that fine lighter hair that's around that 700 nanometer filter, and you want to do a single pulse. Now, if you're going into the darker, denser hairs, usually you want a double and a triple pulse because you need that heat to stay there a little bit longer, and that allows you to do that. So instead of having just a milliseconds, changing your milliseconds, you're able to do that, but you also have that lingering duration of heat just a little bit more. And it makes it a lot more comfortable for those clients as well. Okay. I'm just going to jump into topics, and if anyone has questions, let me know. Another little trick is I use my 430 a lot as well for cherry hemangiomas. Yes, it's more superficial. With the larger cherries, you might have to go deeper in your nanometer, but the 430 has worked very well with the cherry hemangiomas. Now, I do use a spot reducer for that. I use the 430, and the settings that I start with is I start with a 4 milliseconds and 12 joules. And that will just darken them immediately. I've had great success with those. The larger ones sometimes need a couple of treatments, but you are able to do that with this device. And 430 has been the most successful. Whenever you use a spot reducer, you always want to make sure that there's gel in between the spot reducer and the larger crystal. Otherwise, there can be complications. There can lead to a burn. All right. Let's see. Yes, you always increase. So whenever you're putting a spot reducer on, you always want to increase your joules automatically. The reason for that, because you went to a larger crystal, now you're having to match that same energy from a larger surface area, to a smaller surface area. So you always want to increase your joules. So say, for instance, my favorite go-to setting for pigmented lesions is my 515 filter, a single pulse, and I will do 15 milliseconds and 15 joules. That seems to be where I get a lot of success for my pigmented lesions. And yes, this is skin type 1 through 3. With 4s, I bring it down. But say I'm at a 15 and 15, right? 15 milliseconds, 15 joules. If I put my spot reducer on, I automatically start that treatment at 15 milliseconds and 17 joules. So I always increase it by 2. Now, if I put the spot reducer on and I do a couple of test spots and I'm not seeing anything, I'm going to increase it by 2 even more. Don't be afraid to do that. Okay. The highest I went with a spot reducer is 26. The device can go to 40, but the 26 with that 15 millisecond pulse duration as well. Okay. For hands, sometimes you need to have a lower milliseconds and a higher joules to meet that demand and make it a little more snappier. Any questions?
Thanks, Chesney. I've got 2 patients recently that have a lot of pigment and a lot of redness. And I was wondering, when you go to try to treat someone like that, do you try to just treat both indications at the same time, or primarily treat redness one session and then come back and try and primarily treat pigment the other session? What would be your recommendations for a patient that has both of those pretty heavily?
Yeah. So great question. So I would start, is the patient's like skin type 1 through 3?
Yes.
Okay. Okay, perfect. For that combo, my 560 is my go-to. Now, if you do have like a skin type 3 that has quite a bit of sun damage, sometimes I'll even go to my 585, but that 560, it targets the reds and the browns. I mean, I've had people light up like a Christmas tree. I love that saying because they really do. So always target. So the 560 is going to target those vascular lesions, and it's also going to target that pigment. Now, once you do a pass, then what's going to happen is you're going to notice some will be darker, some will be lighter. I will switch to my 515 and I will target those areas even more until I see that clinical endpoint. So I absolutely treat them in one session. Now,
Thank you. That's really helpful.
yes, of course. And with the combo, with the 560, I even sit around the single pulse. I will do a single pulse if it's both those indications. And instead of a double, right? Instead of going double with the vascular, I'll actually do a single. And I will do around a 15 milliseconds and 15 joules. For some reason, that seems to be my go-to and the most successful on the 560 and the 515. If it ended up being like on the chest, then I usually drop my joules down to about 12 or 13, depending on how much is going on. And one thing that can happen too is patients can have a delay, especially those patients that have a lot of freckles. They're going to have sometimes they'll have a later delay. How I want my clients to feel. So when I do a treatment, I always perform a treatment like right here, and it's thicker, it's meatier, but it's an area that they can hide. Worst case scenario, if someone was not being truthful to their skincare products or their medication, right? It's better to be over safe than just going for it. I'll do a test spot right here. If I see some erythema, I'll do 2 more and I'll look at the skin. I wouldn't just do 1 and then just crank it up. If I see that pinkness, I will do it 2 more times. And once you get closer to the cheeks, they're going to feel it a lot more. I want them to feel like a rubber band snap. I want them to feel like they have a sunburn. I do not want them to feel like they've been burned. I always say, have you ever been burned with a curling iron, a stove, or a flat iron? And 99% of the time, people will say yes. And every single time, people will remember what that feels like. We all do, right? It's an initial burn and it never stops. It just lingers until you do something about it. That is what we don't want. So right when we feel that rubber band snap, we don't want that lingering feeling. We want it to calm down and then get mildly warm as well. If you notice someone's getting too hot, you can also change the cooling on your system. Has anyone done that? I'll take that as a no.
Yeah.
Okay, so you can actually change your cooling. So that system defaults to like a 12, 14 degrees Celsius, around there. You just go to your temperature, and usually you want to decrease. I like to hang around at like -5, 0, or you can -5 to 5, I would say, is a good point. And that is really good for bringing some of that overheating on that tissue a little bit more. So it's going to add more patient comfort as well. So if you have someone that's just like, you know, that's hot, they're not having that burning sensation, but they feel really hot and they're kind of getting a little sensitive, bring that cooling down, because what can happen over time is it can heat up. If you change that cooling to drop it to that temperature, you need to put your device in ready mode. Then it's going to start decreasing to that temperature that you want to make it a lot colder. You'll notice that the gel gets a little more crystallized, and that's kind of what you want. When you put that device on standby, it will jump back to that default temperature though. Okay. So if you decrease, if you make it a lot colder, also something to think about on all devices, if you make it colder, it can run through that water a little bit more. So you just want to be aware of how often you need to fill up your device with. So changing that cooling can make a big difference. Okay. And so I actually have for the Darwin and for the Lucent, you can change the default on your system. So instead of it having to be at 12, 14 degrees, on a Darwin and a Lucent, how you can change that, and if any of you need me to email this to you, I'm more than happy to. But you go into the service mode of your system. In the service mode, how to get there is once you're on that screen, the initial screen, it's going to be you should be able to click your top left corner of your device. So you just tap it multiple times. And then what's going to happen is a service mode is going to pop up, okay, with a code. I will put the password in the message. So this is the password code if anyone's interested in changing this. But it's 4563250. Okay. This is the password that allows you to get into your system. Then you go into your, I know I'm just jumping into this, but I wanted to let everyone know. Then you touch a tab that's LD808. Okay. That LD808 is going to then allow you to switch your system. Okay. So it should say offset at the top. And like I said, if anyone needs me to send this to them, I'm more than happy to. And where it says standby temp, this is where you are going to set your temperature. So whatever's defaulted, you touch it, and you can change it to 5. You can change it to the number that you want and press enter. And it should automatically save. Okay. And if anyone has any questions or want to go into it more, you let me know. So do you usually keep it at a standard 12 degrees or do you prefer it to keep it cooler? So if I have a patient that has a lot going on, I will automatically default it to cooler. If I have a patient where I see that they have a little bit of that sun damage, I'm sure we've all seen it, or have some of that redness, I do want that heat, then I will keep it at that default. But to make it more comfortable for your patients, you can absolutely automatically default your system and have it cooler. And it's going to provide a little bit better of an experience for that patient as well. They're going to feel that cold and it's going to be a lot more comfortable. Did that help a lot, understanding how to change the default? Okay. And like I said, you can always reach out to me and say, hey, Chesney, like, do you mind just sending me information? Oh, Dr. Ellison just changed it. Awesome. I love it. So your patient should feel a little bit more comfortable with that. Okay. If you have any issues or for some reason it didn't save, just let me know and I'm more than happy to go through that with you. So it's great if you can change that. But I don't recommend changing anything else in the service menu, just the temperature. So it's going to be, another question that I've had is how do you clean the spot reducer? So spot reducer, instead of just using like a Q-tip and alcohol, it's very hard to sometimes get into those sharp corners. You want soap, just get some gauze and put soap in it and go in the sink and you can actually clean it all out and flip it upside down for it to dry. That is the easiest. It avoids having that buildup of that ultrasound gel, which can kind of discolor over time. Okay. So I see we have like 14 minutes left. Is there anything you want me to go over? Is there any questions? I'm here for you, so please let me know.
When you go to the Clarion meeting, are you going to let us know all the new things that you find out, or?
Absolutely. I'm huge on education. Yes, absolutely. I will let you know if there's any changes. And we'll also create another setup like this so then I can answer any questions if there are any changes and advancements. And that's the reason also why I'm going, is to really push their device to its limit and get the best results the safest way. So kind of more advanced on how to really utilize the other mode settings besides just treating discomfort and adding a little bit longer of a heat.
I do have a question about the cooling. I know we're kind of beating that topic to death,
Yeah.
but if you cool it off to achieve more comfort to the patient, are you compromising their treatment, do you think? Our old machine was not as powerful, and so our patients for this machine are having a harder time tolerating it.
Okay. It absolutely will not affect the treatment. It keeps the surrounding tissue a little bit colder. Now, if you were to leave it on there for a period of time and then treat, then it can affect some of the vessels, but absolutely, you'll still get great results with it.
Thanks.
Mm-hmm. What, if you don't mind, what filter, is it just a treatment in general, or is it a specific filter that they're more uncomfortable with?
Yeah, we just have barely had our machine, so we're still playing with it. But
Okay.
just the treatment in general. Our other one was a Candela ELO system, and it wasn't very powerful. It had the radio frequency and a cooling tip, and we didn't need any numbing cream. And so from that to this, they're asking for numbing.
Yes. So numbing, I don't recommend it. And this cooling will absolutely help with that, or having like a little squeezy ball, giving them some time. You can even do cool gel if you wanted to. I know a dermatologist that actually mixes ultrasound gel and normal saline in popsicle sticks. And that's pretty cool. And he uses the popsicle stick and has that cooling to treat as well on top of the IPL. So that's really neat. So that's another alternative as well. This device absolutely is one of the strongest IPLs I've worked with. This is my top favorite. And because you can use so much with it. So I would do like a little squeezy ball, cool the area down. It won't affect the treatment at all. And sometimes just giving them a little bit more time. I do know when treating women as well, if they're close to their cycle or just finished their cycle, no matter what treatment, they're going to have fight or flight. So they're going to be a lot more sensitive during their treatment. So you want to take that into effect as well. But if your patients are still having a hard time with the treatment and trying to figure out some solutions for comfort, let me know, and I'm more than happy to discuss some options with you as well.
I'd love to hear about some of that right now, actually, because I don't know if people are different out in Washington State, but it seems like whenever I go on the recommended settings, I've got people squirming and like they really just don't tolerate it very well. So I'd love to hear some ways to make people a little bit more comfortable without using numbing, if that's possible.
Yeah, absolutely. So one can be, you can have the patient take Tylenol. If it doesn't contraindicate their medical history, they can take it 30 minutes before the recommended dosing. That helps kind of take those nerves away as well. Another option is that cool gel, cooling the device more. Sometimes those patients, you can switch it to that toning if needed, or giving them some time. Now, I know some patients also jump around. I'm just going through some things. I'm not saying that anyone has done it, but sometimes patients can get a little more frightened or jumpy, a little more squirmy if they're not communicated, if no one talks to them about what's happening. So instead of just doing a treatment, just doing it step by step, just touching their shoulder. Okay, so I'm going to do a test spot. Please let me know how it feels. And then kind of going from there and just letting them know around the mouth, it's going to be spicy. When in doubt, you can always put the spot reducer on them and treat them with that. Now, I know that takes more time, but that's another thing as well. Squeezy balls, something that just adds as an easy distraction. I've had patients kind of wiggle their toes a little bit if they're really sensitive. With the sensitive patients, have you been having great results, or have they been diminished because of their sensitivity?
I've only had it for about 2 weeks. I've only treated a couple of patients, but I think I had promised them that it was going to be not too big of a deal, and I think that they were a little bit surprised by the energy delivered.
Okay.
So I think that they're all going to have reasonable results, but I think it was just the expectation of previous IPL treatments that they'd had. This was a little bit more spicy for them.
Okay, gotcha. Did you do the previous IPL treatments?
No.
Okay, that's why, because they're getting a good treatment now. So just letting your patients know it's going to feel like a rubber band snap. Now, some areas can be sensitive. Just letting them know and kind of walking through that. Well, another thing too is if the handpiece is tilted, if it's not fully in contact with the skin, it produces more heat on top of the surface, which can make it uncomfortable. Someone that's never had this treatment done before, or another thing can be, the spot reducer helps with that. Another thing can do is you can bring that energy down, because it's going to take more than one treatment, right? On average, it takes about 2 to 3 treatments. So another thing is you can bring that energy down, or switch to a double pulse, or switch to a toning pulse, change your pulses, and that will help a lot and bring that down a little bit. Another thing is you can bring that energy down, but just do 2 passes instead of 1. So you're creating that bulk heating effect instead of that snappy effect. So there's a lot of things. That's why you can do a test spot. If someone has a lot of reds, they are going to be more sensitive, and just letting them know that. Be like, you're sensitive. It's more, we're putting heat right where those nerves are. It's going to be a little bit more sensitive, and just letting them know, just breathe through it. You'll get through it. After that, you'll feel like a little bit of a sunburn. So what helps a lot is that communication. I've never not had a patient not get a treatment. but it's going to be giving them those options to allow a better experience and expectations as well. So when in doubt, just spread that heat a little bit more and do a double pulse. Or like I said, I with my experience, I really don't use triple pulse. So when in doubt, I actually do a toning, and then I'll put a spot reducer on and I'll target those things I really want to target without using the larger crystal. It is a larger crystal, so you are actually treating twice and that's why it's a little, it's got some weight to it a little bit. I've dealt with heavier ones, but the tip, so I've compared the Lucent crystal handpiece to a lot of other IPL devices, and it's twice the amount. So you're treating an area much larger than sometimes you think you are. So you really want to sometimes spread out those passes. The nose, the lip, the eyes, and the temples, sometimes the forehead, I always treat with a spot reducer. The only time I actually use the big crystal is if I can do the sides. I will do a V right here, so I'll actually crisscross my crystals because it will fit. Sometimes I can do it right here or do a nasolabial pass. Sometimes I can fit on the forehead, but otherwise those areas I switch to the crystal. So I'll have this spot reducer with a little bit of gel on it right on the side of my table. When I look at a patient, I'll just grab it and I'm like, okay, I know I'm going to need this. Do a little dab of gel and I'm already there and I can just do a quick and go. Other things that have helped is the T-bar. A T-bar helps. You're not working with radio frequency, so you're absolutely fine to use it. They just need something in their hands. So if they have something in their hands, you'd be surprised how much that goes away. I don't recommend using a Zimmer if someone has a Zimmer or a fan. The reason for that, because it's going to dry up your ultrasound gel really quickly. And then you're going to have to fight with that drying of the ultrasound gel, and it's going to take a lot longer for you to do a treatment. Has anyone had issues with their goggles or with their sticky eye shields? Oh. Well, so I personally, I didn't know what else. Oh, so let's see here. Saw that something popped up. Well, my favorite are the sticky eye shields because I can move them and move them around. When in doubt, if you don't want to use that small spot reducer, you can use a white gauze. You can use white foam. I even do this, and I will take some of that light out and I'll do a treatment because there's no color to it, right? IPL is attracted to water, oxyhemoglobin, and melanin. Let's see here. So Leslie, you had a session done on yourself. Of course, the crystal isn't completely intact to the skin and it hurts way more. Sometimes it looks like it's completely touching, but it may not be. So exactly. And sometimes I do it. But if that crystal is just tilted a little bit above the surface, if you still see that light, what happens is that energy, it does become a lot more sensitive. So when you do pigmented lesions, you can put pressure onto the skin. It's not going to affect the treatment, and sometimes it's more comfortable. If you're doing vessels, you want it to sit on top of that surface, and it is what it is. They're going to be a little flinchy. You just have to tell them, just work with me. I'm just going to do a couple more spots. 4 more, let's do it. Just kind of motivation, right? Everyone loves some motivation. And so when I started doing more trainings with this IPL, a little thing that I just said, and it helps a lot, is you don't have to look at the light. You're not a bug, okay? You already know your handpiece is. You can feel it. If you tilt it, you can feel heavier on one side of the handpiece. If you're lifting it and you're having to put more effort into one arm, like you're holding it, that means you're tilting up. So you want to think about your body mechanics, feel how the handpiece fits, put it against the nose. Same with the smaller crystal. You can feel it where it tilts versus it being flat. You can see the outline of the silver of the larger crystal. You can see it. That doesn't mean you have to look at the light, right? So I like to tell people now, you're not a bug. You don't need to see the light, and you don't want to because it's not fun staring at it. So you want to make sure, just think of your position. It's better to go slower when you're doing a treatment and really understand how it feels. Like, I can put a handpiece on someone and be blindfolded and I can see how it feels. And I know exactly if I'm lifting or churning. So it's better to see and understand those mechanics and do it slow, and then you'll be faster over time. When you are doing a treatment, remember you do have the option of a foot pedal, or you can do hand. So you do whichever makes you feel more comfortable, allowing you to perform a treatment. I never have a patient use a pillow because I want their chin to be up since I'm treating behind them. So that's another thing that can also help as well. So, yeah, Leslie, you made a great point. Absolutely. And if you can find someone to give you a treatment, that is the best to know how it feels. So I know we're kind of wrapping things up. Is there any last question that I can answer?
Yeah, Chesney.
Mm-hmm.
So you said that if somebody is, really hurting, and you can change from single pulse to double pulse, if you're going to do that, should you stay at the same joules and milliseconds when you go to the double pulse and just see how they do with that?
So that's a really good question. Changing from a single to a double, it is going to change your parameters quite a bit. Now, going from a single to a toning, I usually stay around the same, but the double pulse is definitely going to change things. Yep. So you might want to change. So say, for instance, if your energy was at, I'm just throwing it out there, 15 milliseconds, 15 joules.
Right.
You go to a double pulse. I believe usually it defaults, if I remember, 7 milliseconds with a 20 millisecond delay. And was it 10 joules, 12 joules? I'm like, I think so. So your milliseconds have dropped, and you also have a lower energy now. Okay, which means that it's going to be snappier in a period of time, but it's going to be a longer. So you might have to up those milliseconds and up that energy a little bit more.
Okay.
Mm-hmm.
Thank you.
Absolutely. That's a great question. If anyone has additional questions, more than happy to email me. And it was a pleasure speaking to everyone, and I hope this was very helpful. And if so, we would love your feedback, and we will produce more of these. Thank you, everyone. Appreciate you. Thank you for your time.
Thank you.
And absolutely. And I'm here for you. So anything you need, just let me know. Have a wonderful week.
You too.
Thanks. Bye.